date. You know, but you can usually tell, you know, if there's some cognitive changes when you ask them the date and they can't even tell you anywhere near the month. And then you can ask them, what brings you in today? And they'll talk to you, they'll tell you. So basically, that is the way that you're going to test their orientation status, okay? Then you're going to test their memory and distant memory. You could ask them, you can tell them 3 words, and then later on at the end of the assessment you can ask them to restate those 3 words, and that will test their distant memory.
So basically you'll say to your partner, I'm going to give you 3 words, okay? Before you start their neurological assessment, you're going to say, I'm going to give you 3 words, cat, dog, house. At the end of my examination, I'm going to ask you to repeat those 3 words, okay? And then you'll go into saying, you know, what is your name? You know, what is today's date? Like Teresa said, what brings you in? Why are you here today? So that you're assessing not only their cognitive function of being able to tell you why they're there or what their name is, but also their clarity of speech. Okay,
yes,
that's
do
very
the words
important.
flow smoothly, or
are they having problems finding the words,
or slurring, or you know, garbled speech? You know, the next thing you'll want to do is you're going to want to test their upper and their lower extremity strength. You might do this by having them lift their arms off of the bed, okay, and see how long they can keep their arms off of the bed, and you count to 10. And if they start to go down, then you know that their strength is altered. Okay, you can have them grab your hands and squeeze both hands, okay, to see if they have equal strength in their arms and their hands, okay. And you can also, another thing you can do with the lower extremities is you can have them bend at the knee and push against the resistance of your arm, okay. After you have them lift the leg off the bed and you do the same thing you did with the arms, then you're going to want to do the resistance strength on both legs, okay? Some of these things we do every day at the hospital in our assessment, depending on what the problem is, but some of the things like the 3 words I have never done at the hospital in part of my assessment. That's just part of the
that's part of mostly you'll see outside clinic.
Yes,
okay,
outside
the doctor
clinic.
will assess that, or the GP will assess that just to assess your remote memory.
Right, right.
That's something we know, I'll be back and then tell me.
Nurses don't have remote. I can't remember the words.
Yeah. So anyway, then what you're going to want to do is you're going to want to check light, pain, and touch of extremities. So what you're going to do is you're going to have the patient close their eyes, and you can take like a cotton ball.
I'll bring some Q-tips.
Or you can,
I'll bring Q-tips.
So.
Because it has the cotton, and then
it has the stick at the
end.
Yeah, that you can break off for the painful stimuli. So, but the cotton end you can assess for light touch. So you have them close their eyes, and you're going to touch either one side or the other, and they'll say, you know, left side, yes, left side, right, you know, wherever it is.
They'll tell you which side
they'll
you're
tell
touching.
you, yeah. So they'll assess this, then you might do over here, you might do their leg, or you might do them both at the same time, and they should be able to tell you that you're touching them both at the same time, both sides. And then the painful stimuli, you're using the stick end, you're doing the same thing, you know, with the different extremities, or you might touch their face, their cheeks, here.
So you'll ask them at the beginning, you'll say, I'm going to be touching a part of your body, and I want you to verbalize to me which extremity I'm touching or where I'm touching, and they should be able to tell you that.
But they should have to keep their eyes closed the whole time, because that's the only way you're going to be able to get a true answer from them, is if their eyes are closed so they don't know, they can only feel. So anyway, let's see here. So assessing the cerebellar function, like we talked about in lecture, you're going to hold your finger out to them, and you're going to have them touch their nose and touch your finger, touch your nose, and then as you move your finger, they're going to go back and forth like this, and they should be able to coordinate back and forth.
And usually you increase the speed as you go. Okay.
Okay, so assess for the pronator drift. They're standing with their feet together. their eyes are closed and they're holding their arms out with palms up for 10 seconds. Okay? You might see a little bit of a drift, which is normal because visual is part of equilibrium. Like right now I get in a little teetery with my eyes closed. But, I mean, that's normal. But they should be able to hold their arms out just like this, okay, for 10 seconds without dropping their arms at all, without them drifting down. So
And
that's
how
what the
you assess
pronator
for
drift.
stroke, like Anna said, because usually if one side's affected, you're going to be like
Yeah,
this.
right,
Because
exactly.
they're weak on one side.
Yep. Okay, so assess for the tandem walk. Walk on your heels and toes, knee bends, and hopping. That's basically self-explanatory. But what would you not want to do with an older person? What
Correct.
you would not want them to hip hop or hop on, because older people can't do that regardless of this. You know, they're old. So anyway, like I would never ask Armando to hop on one.
That's why he doesn't want to be in your video. So
I
do
got
we
that
know
on
what tandem
tape.
walking is? This is what the police usually do when they're
Yep, tandem walking. Yeah.
when they're assessing whether or not you're drunk. Okay, that's tandem walking. That's what you're going to ask them to do because.
And then
not a
you're
lot of
walking
people
on
know
your
tandem.
heels. This would be walking on your heels. And then you have them walk on their toes. Okay? Knee bends. You know, you don't expect them to go down too far because if they're not in shape, even young people can't go down too far. And then hopping, but like I said, you don't want, you know, older people to have to do this. So you would never ask them to do that. And then the Romberg test, okay, which, refresh my memory, standing.
Usually, the book doesn't tell you to close your eyes. That's
Close
why
your
I
eyes.
don't have you, because the book just tells you to do this and go, I believe, side to side. I think that's what it tells you, right?
Okay.
Double check.